Here are the top stories for today, August 13, 2020. The government is set to provide 30 million face masks for poor and vulnerable sectors to help prevent COVID-19. Malacanang defends the reimbursement received by the Southern Philippines Medical Center from PhilHealth. The Light Rail Manila Corporation adopts a risk-based approach to test LRT-1 workers for COVID-19. And Defense Chief Lorenzana expresses confidence that Metro Manila can return to general community quarantine. Good day, I'm Rom Dulfo. Welcome to PNA Newsroom. The government launched a community distribution of free washable face masks to the country's poor families and vulnerable sectors. This is to ensure that they comply with the health and safety protocols against the coronavirus disease. William Theo with more.
The Department of Health, or DOH, seeks to provide about 30 million free face masks to Filipinos as it launched the Vida Solution Mask Vida, or Mask for Vulnerable and Indigent Delivered and Available Laban Contra COVID-19 campaign. The program seeks to boost the efforts of both the national and local governments to combat the pandemic while providing livelihood to others. According to DOH Secretary Francisco Duque III, proper wearing a face mask reduces the spread of the virus by 85%. Trade Secretary Ramon Lopez said the reusable masks are produced by the small and medium enterprises as well as the dressmakers from TESDA. The province of Rizal has initially received about 20,000 non-medical grade washable and reusable face masks, along with the hygiene kits and COVID-19 testing kits from the DOH. Meanwhile, National Action Plan Deputy Chief Implementer Vince Dizon said the government is set to build a mega quarantine facility in Rizal Province through the Department of Public Works and Highways. DILG Secretary Eduardo Año said those who tested positive for COVID-19 should avoid home quarantine and has to be put in isolation facilities to stop the spread of the virus in the household. Año reiterated his advice to the Filipinos to practice the minimum health standards inside their homes, such as proper hand washing, particularly if one member of the family is working outside or has essential travel. For the PNA Newsroom, I am William Theo.
More than 90,000 pieces of face masks would be distributed for free to residents and frontliners in Muntinlupa. These masks are made by over 100 unemployed sewers hired by the local government under the Tulong Pangkabuhayan para sa mga displaced workers or TUPAD program. Aside from face masks, they also made personal protective equipment, suits for medical frontliners. Meanwhile, Pasig City uses a reservation system for their antibody testing for COVID-19. This is to prevent residents from gathering inside the hospital in violation of physical distancing and other quarantine health protocols. Mayor Vico Soto said only 300 slots are available per day. The free antibody test is available at Pasig City Children's Hospital, which is the city's COVID-19 referral hospital. At least 50% of public schools in the National Capital Region will be converted into isolation centers for COVID-19 patients. Presidential spokesperson Harry Roque said this has already been negotiated and agreed by both the Department of Education and the Department of Health.
Pumayag naman po si Secretary Leonor Briones na gamitin ng mga public schools hanggang December 31 ng taong ito, habang wala pong face-to-face ang ating mga estudyante. So bukod pa po dun sa mga struktura na tinatayo po ni Secretary Villar, ang ating isolation SAR, nandyan din po ang ating mga public schools para magsilbing isolation facilities sa level po ng mga barangays.
Meanwhile, employees will be required to wear face shields in working areas starting August 15. Labor Chief Silvestre Bello III said workers will not be allowed to enter the workplace if they will not follow the health protocol. Bello said wearing a face mask and face shield is the new protocol in the workplace to protect employees from contracting the disease. Bello said employers are liable for non-observance of the health measure in the workplace and might cause the closure of the establishment. The interagency task force has proposed that employers should purchase face shields for their employees. The Presidential Security Group, or PSG, will allow President Duterte to be injected with COVID-19 vaccine from Russia as long as it has received approval from the Food and Drug Administration, or FDA. Presidential spokesperson Harry Roque earlier said there is no certainty whether the PSG will allow the president to be injected by the vaccine, despite being the first volunteer. Roque said President Duterte's willingness to be the first person to be injected could also be taken as a signal to the FDA to ensure the thorough review of the vaccine before it is administered to the public. Before vaccines are mass-produced, Roque said they would first have to undergo clinical trials. FDA Director General Eric Domingo said he would first like to know what approval process the vaccine went through. Domingo raised concern about the Russian vaccine because it has yet to enter phase 3, or the last phase of clinical trials. He said the FDA approves vaccines only after the completion of tests on a large number of patients and once the safety and efficacy of the vaccines are assured. Officials of the Department of Science and Technology, or DOST, met with the manufacturers of the Russian vaccine to discuss the third phase of clinical trials. According to DOST Undersecretary Rowena Guevara, representatives from the Gamaleya Research Institute of Russia, the DOST, and the Philippine Vaccine Expert Panel discussed the process of registering the Sputnik V vaccine in the Philippines. The FDA says the third and final phase of clinical trials will be tested on 300 to 3,000 volunteers. Meanwhile, the DOST says it is considering the local and finished type of manufacturing should the Philippines be given the opportunity to reproduce vaccines made by other countries. The DOST says the country does not have the capability to develop and manufacture COVID-19 vaccine as it does not have the facility. Guevara confirmed that even if Russia was the first to register a COVID-19 vaccine, the DOST would still welcome clinical trials on vaccines that are being manufactured by other countries, as long as these would get the FDA approval. DOST Secretary Fortunato de la Peña earlier said that he submitted a proposal for the establishment of a virology institute in the Philippines for the development of vaccines, diagnostics, and therapeutics. The production of COVID-19 vaccine in Russia is set to start in 2 weeks. Gamaleya says the same vaccine will be used for children and the elderly, but dosage and how to administer the vaccine still needs additional research. The Chinese embassy in Manila welcomed the FDA approval of Lian Hua Qingwen, a China-manufactured herbal medicine. The embassy said this marks an important progress in the entry of traditional Chinese medicine products into the Philippine market. Based on its FDA-issued certificate of product registration, Lian Hua Qingwen helps remove heat toxin invasion of the lungs, including symptoms such as fever, aversion to cold muscle, soreness, and runny nose. The herb product is used to manage mild and moderate COVID-19 cases in China. However, there's no indication yet it can be used as a COVID-19 treatment in the Philippines. Still to come, Malacanang defends the reimbursement received by the Southern Philippines Medical Center from PhilHealth. The Light Rail Manila Corporation, or LRMC, adopts a risk-based approach to test LRT1 workers for COVID-19. More on these with the PNA Newsroom continues.
Tandaan ang tamang paraan ng paghuhugas at paglilinis ng kamay upang makaiwas sa iba't ibang karamdaman. Basain ng tubig ang mga kamay at sabunin. Unang sabunin ang mga palad at ang likod ng mga kamay. Kuskusin na maigi ang pagitan ng mga daliri at maging ang mga kuko. Isunod ang pagitan ng mga hinlalaki at kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad. Banlawang mabuti ang mga kamay sa malinis na tubig at patuyuin ang mga kamay gamit ang single-use towel o air dryer. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Senators are eager to suspend PhilHealth's interim reimbursement mechanism until policy changes have been made. House leaders, meanwhile, recommend the filing of plunder charges against all PhilHealth officials involved in the so-called mafia.
Senators are calling for the suspension of PhilHealth's interim reimbursement mechanism or IRM until policy changes have been made for an accountable and equitable distribution of the advance payment scheme. Senate Majority Leader Juan Miguel Zubiri said a formula is really needed in the disbursement of the IRM because it is very prone to corruption. It was revealed during the hearings that a large portion of IRM funds have been disbursed to dialysis centers and maternity clinics. It was also found out that disbursements in certain regions or hospitals were immediately released while other regions or hospitals are still waiting for their respective releases. Meanwhile, the Department of Justice is awaiting the formal request from the Senate to place individual whistleblowers in the alleged anomalies in PhilHealth under the government's Witness Protection Program. President Duterte earlier directed the DOJ to form a task force to investigate a massive corruption within the PhilHealth. House Committee on Public Accounts Chair Michael Defensor recommends the filing of plunder charges against all officials of PhilHealth involved in the so-called mafia that runs various fraudulent schemes. During a joint House hearing on the alleged graft and corrupt practices in PhilHealth, Defensor questioned the sharp rise in the number of claims for various health cases over the years. He pointed out that this could be one of the schemes of the mafia in the agency, particularly noting faster transactions in private hospitals compared to government hospitals. For its part, Malacanang says there is nothing irregular with Davao-based Southern Philippines Medical Center or SPMC receiving the biggest chunk of cash advance from PhilHealth. Presidential spokesperson Harry Roque defended PhilHealth's move to give the biggest compensation to SMPC, saying the state-owned hospital in Davao City is a 1,500-bed hospital with almost 3,600 personnel. Roque said that SMPC also has the biggest hemodialysis in the country with 65 dialysis chairs. For the PNA Newsroom, I'm Marita Muaje.
The Light Rail Manila Corporation on Wednesday said it has adopted a limited approach to testing for COVID-19 among its workers. In a statement, the LRMC said its strategic risk-based approach for RT-PCR testing for its personnel was in line with the Department of Health's guidelines. LRMC has prioritized those with symptoms and those with exposures to confirm the cases. Transportation Secretary Arthur Tugade earlier tasked the LRMC to conduct mandatory testing for COVID-19 for all its workers. He also ordered Philippine National Railways General Manager June Magno and DOTR Assistant Secretary Fidel Cruz to review the COVID-19 health and safety protocols at the LRT-1. In response, the LRMC said it has recently rolled out new measures through the use of ultraviolet C technology for disinfection, deployment of thermal cameras for screening passengers, and a contact tracing app for the public. The increase of online shopping since the implementation of community quarantines to address the rise of COVID-19 cases cannot be attributed primarily to the metropolis but nationwide. Shopee Philippines cited the increase in people turning to online shopping to find their basic necessities such as groceries and personal hygiene products. The online platform recently launched the Where You Shop Matters partnership with digital payment solution provider Visa. The partnership aims to encourage consumers to support local businesses and boost the small and medium enterprise sector by helping them to have or to increase their online presence. The tie-up will give discounts to Visa cardholders when they shop at local merchants registered with Shopee. Visa said this tie-up is in line with their small business program to support 10 million small and micro businesses in the Asia Pacific amid the COVID-19 pandemic. Up next, Defense Secretary Lorenzana expresses confidence that Metro Manila can return to a general community quarantine or GCQ. And the Philippine Information Agency leads the planting of 450 pine trees at a PCOO-adopted park in Baguio City. The PNA Newsroom returns after these reminders.
Sa matinding laban natin sa Coronavirus Disease 2019, sugpuin din natin ang pagkalat ng fake news. Huwag magbahagi ng impormasyon na hindi tiyak ang pinagmulan. I-check mabuti ang source ng balita. Kumuha lamang ng impormasyon mula sa mga official channel ng Department of Health. Huwag magpadala sa maling balita. Basta't sama-sama at laging handa. Kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito. Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Defense Chief Lorenzana on Wednesday said he remains confident the National Capital Region can go back to the less stringent General Community Quarantine or GCQ as the modified ECQ lapses on August 18. Lorenzana's remarks came after COVID-19 cases saw a single-day record spike of 6,958 new infections on Monday. This was the same day he said the NCR is ready to shift back to GCQ due to the gradual decline of new cases of the disease. Lorenzana earlier said the country cannot continue imposing lockdowns as there is a pressing need to do something to reopen the economy. Metro Manila Council Chairperson Parañaque City Mayor Edwin Olivares meanwhile expects that the NCR will be placed under GCQ if the decreasing number of COVID-19 cases continues. Olivares says the implementation of MECQ in Metro Manila has been effective. On Wednesday, the Department of Health reported 2,618 new cases in Metro Manila. The Schools Division of Ilocos Norte is all set for the opening of classes on August 24 amid the COVID-19 pandemic. School Division Head Dr. Joanne Corpuz assured the implementation of the Basic Education Learning Continuity Plan is 100% ready to ensure all learners in the province will have access to quality education this school year 2020-2021. To date, about 89,000 learners are enrolled in public and private schools in Ilocos Norte's 21 towns. This is 96% of the total of those who enrolled last school year. Corpus said DepEd Ilocos Norte gears toward flexible teaching and learning delivery options, enhanced support to schools and learning centers for efficient and effective governance and operations, and partnership, engagement, and collaboration. Guided by the theme Handang Isip, Handang Bukas, this year's opening of classes pointed out the goal of discovering and exploring opportunities to be more creative and innovative for learners. Cotabato City has banned all movement starting Sunday after the sudden resurgence of COVID-19 merely hours after cases in the city dropped to zero. Marita Muahe with more.
Cotabato City Mayor Frances Cynthia Guiani Sayadi is set to impose the no movement Sunday policy starting August 16. This after 2 workers of the Cotabato Regional and Medical Center tested positive for COVID-19 in less than 24 hours after she announced a 0 case of the virus in the city on Wednesday. Local transport system is suspended on Sunday and only those with emergency cases are allowed to go to hospitals. Only drugstores would remain open and frontliners are allowed on the streets on Sundays. Meanwhile, the provinces of Negros Oriental and Negros Occidental are now deliberating on health and safety protocols for sugarcane workers who will be crossing borders on the island in time for the milling season next month. The Negros Oriental Disaster Risk Reduction and Management Office said that cross-border protocols for those working in the sugar industry in Negros Oriental are necessary to ensure the safety of all. Aside from migratory sugarcane harvesting workers or tapaceros, also included are drivers and assistants of cargo trucks that hold the harvested sugarcane. Some of the concerns that were initially discussed are requirements such as testing for COVID-19, quarantine facilities for the duration of the workers' stay in a particular area, provisions, and other necessities. In Leyte, a community in Barangay Holy Child 2 in Alangalang Town is placed under lockdown on Wednesday to prevent the spread of coronavirus disease. The local government said the directive will last for 2 to 3 days while waiting for the swab results of individuals who had exposure to its patient, a 3-year-old daughter of the 38-year-old policeman who earlier tested positive for the virus. To date, the town has confirmed a total of 27 COVID-19 cases. For the PNA Newsroom, I'm Marita Muahe.
Manobo tribal leaders in Mindanao on Wednesday condemned the alleged misrepresentation, false claims, and the use of the indigenous peoples by Save Our Schools group and Bayan Muna representative Eufemia Culiamat. In a statement, IEP mandatory representatives of Surigao del Sur, Datu Jomar Bucales and Datu Rico Maca, said Culiamat and Bayan Muna, together with other alleged leftist groups like Atribo, Pasaka, and Karapatan, continue to misrepresent the true IPs. They said these groups raise and solicit funds on behalf of the IPs, but these same funds are allegedly being used to buy weapons to kill them. He said these groups pass on the blame to the government when it is actually their groups who are killing and suppressing the IPs. Meanwhile, Bucales said they are asking the United Nations and the public not to listen to these groups. The two Datus called on Culiamat and the other groups to stop using IPs and face them instead. The government has launched Project Hope in Iligan City to empower indigenous peoples and former rebels and stop the local communist armed movement. Christine Lynn Viajante has the story.
Region 10's Poverty Reduction Livelihood and Employment Cluster launched its Heal One, Protect Everyone program, also known as Project Hope, in Barangay Rugongon, Iligan City. Project Hope aims to make indigenous people's communities self-reliant, resilient, and empowered in support to Executive Number 70, or the whole-of-nation approach to end local communist armed conflict in the region. Spearheading the PR-elect Region 10, TESDA will construct an IP hub hub in the said community where its free skills training program will be conducted.
Under Project Hope, mag-start muna tayo sa conduct of skills trainings. So it's really a convergence. Gone are those days that the national government agencies will implement program without involving the other national government agencies, because the mandate under EU 70 is very clear that we really have to harmonize and resource pooling.
Through DILG Illegans' efforts, a convergence of local and national-aligned agencies handed over different relief for former rebels and IPs in the community, few of which are DTI's livelihood starter kits and the Department of Agriculture's seeds and farming tools.
Sa ato ang pinalangga nga presidente nga si Rodrigo Duterte nga diin gitagaan ganiya og tabang ang amuang IPs community. So sa una, kini mong barangay sa una dili na ingon ani sa pagkakaroon murag nakabangon na tungod sa hinabang sa mga lain-kalain-laing ahensya sa gobyerno.
For PNA Newsroom, Christine Lynn Viajante of PIA Iligan City Information Center.
The Philippine Information Agency, or PIA, led the planting of 450 pine trees at a tree park adopted by the Presidential Communications Operations Office in Baguio City. Members of the Philippine Information Agency, Cordillera, Philippine News Agency Baguio Bureau, PTV Cordillera, and Radyo Pilipinas planted 2 Norfolk trees aside from the pine saplings at the pine trees of the World Park. PIA Cordillera Regional Director Helen Tibaldo said this is in compliance to the tree replacement policy of the city government and the Department of Environment and Natural Resources. PIA Cordillera is set to build its regional office here, where 12 matured Anchoan Dilaw trees and 2 avocado trees will be felled to give way to the structure. Tibaldo said they will schedule a visit once a month for the nurturing of the trees planted. Forester Walter Aguirre of the City Environment and Parks Management Office said they encourage residents to plant trees so that the city's environment will be preserved. And before we go, members of the Scintilla Juris Fraternity and Confraternity, the Astrum Siente Sorority, and the Stella Juris Sorority are urging the public to join their nationwide blood donation drive in order to help address the shortage of blood supply during the pandemic. The SJASSJ network will hold Blood Sparks for Life nationwide. For details regarding Blood Sparks for Life and how to participate, they can be reached through their Facebook page at Blood Sparks for Life or through email bloodsparksforlife@gmail.com. Let's take another look at today's biggest stories. The government is set to provide 30 million face masks for poor and vulnerable sectors to help prevent COVID-19. Malacanang defends the reimbursement received by the Southern Philippines Medical Center from PhilHealth. The Light Rail Manila Corporation adopts a risk-based approach to test LRT-1 workers for COVID-19. And Defense Chief Delfin Lorenzana expresses confidence that Metro Manila can return to general community quarantine. Thank you for watching another episode of PNA Newsroom. To check more news content, visit our webpage or head to the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags on our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also watch us on television on PTV4 and IBC 13. And that's really those of the biggest stories that you need to know from PNA Newsroom. I am Rom Dulfo. Good day and stay safe.